Good morning, everyone. Thanks for attending the press conference this morning. We're going to talk about homeless issues and homeless services. And I'm going to start out with an introduction, and then I'm going to finish up with a conclusion. Meanwhile, we'll have the speakers introduce themselves and tell you about their services as well. So first of all, I want to start out with really the point of being here, the point of discussion today, and that is the homeless situation in Rapid City. Homelessness takes many forms, and Rapid City's most visible homeless issue at this moment are individuals and groups who seem to be wandering in the central part of town. They may be sitting or walking, but you see them in that part of town. There's a high percentage of this particular group of homeless who suffer from addiction, primarily but not exclusively an addiction to alcohol. Many members of this group do not seek, nor will they accept services. Many members of this group, based on all of these factors, choose to camp outdoors rather than seek the homeless services that we have. And in the last few months, the homeless population is growing. There's been an influx from the local Indian reservations. Many who are here, many new homeless members who are here are attracted by the free food in parks. There are several groups now feeding homeless members in city parks and about town, and that is a big attraction. We know this because this is what they tell us. Many of this group are also attracted by the availability of alcohol. So now we're entering a different season. We're fully into autumn, and winter will come in a few months, but winter weather will be here sooner than that. Life in the outdoors through winter in South Dakota, regardless of free food, is not sustainable. There's been mounting pressure for local government to fix this, specifically to provide housing for these homeless individuals, as long as it's housing that will allow them to live their current lifestyle, and as long as it's before winter. And there are many rumors out there. Rumors are one of our greatest enemies in public service, and especially today, because I feel people are more likely to listen to a rumor if it's in print on social media than ever before. Some of the rumors are that there are 300 homeless individuals walking around town, and that Rapid City only has 17 beds. That's false. In fact, both of those numbers are false. There are rumors that the homeless are being murdered along Rapid Creek in the last month or two. That is false. There are rumors that the homeless are dying from exposure on Rapid Creek. That also is false. There's a relatively new rumor that those individuals who are here from a reservation now feel that they are unable to go back to the reservation because of the roadblocks. And there's no reason to believe that is true either. So now I'd like to introduce our Police Chief, Don Hedrick.
Thank you, Mayor. As law enforcement, we are appointed as the 24/7 caretakers and protectors of citizens in Rapid City. And this includes our vulnerable homeless population. And I can tell you our officers are out on the street every day working to ensure safety for our city's homeless. I just wanted to touch real briefly on some of the things that we are currently doing or things that we've recently accomplished. In January of 2018, the Rapid City Police Department stood up our Quality of Life unit. This is a unit designated to specifically address the vulnerable homeless in our community and get them connected up with social services. Through diligent casework and partnerships with folks in our community, we've been able to help many. To date, we have at least 70 people that we have taken off the streets, and that's a big deal. This is a population that I'm talking about here that law enforcement would deal with regularly on a daily basis, sometimes multiple times a day, and now they're in a different location off the streets. Through grant funding, we're currently working on trying to expand our quality of life unit by adding 2 social workers. The focus of those 2 folks would be street outreach and coordinating with service providers. It's kind of a work in progress at this point. In the spring of this year, we stepped way outside of our comfort zone. We partnered with the Sheriff's Office, Emergency Management, the Fire Department, Norma Rendon and her nonprofit, Where All Women Are Honored, to stand up a temporary shelter for the homeless with COVID symptoms. This was an unmet emergency need in the community at the time, and I hope it doesn't come to it, but if it does, we have to partner with the community again to continue that effort if need be. Another thing we've worked on, we partnered with Main Street Square in downtown Rapid City to continue our ambassador program. Not only has this been a good group to meet with tourists and explain what Rapid City can offer, but the group, the fellows and women with the polos on walking around downtown have also been an extra set of eyes for the police department. And we've noted a definite deterrent effect for crimes like panhandling with those individuals walking around downtown. In response to needs coming from patrol and patrol officers, we've partnered with Volunteers of America to assemble family care bags. These are bags with food items, diapers, wipes, and formula that we can use to meet an immediate need or an immediate crisis, and at the same time, build a relationship while connecting folks with longer-term support systems. Additionally, we've we've partnered with Volunteers of America to put together a hotel support system. If somebody's in a very immediate housing crisis need, we have the ability to pre-approve limited hotel stays. And in that moment, service providers then are able to work with these individuals and help them get into more longer-term supports or housing opportunities. We do recognize there are groups that are taking steps to encourage folks to live and sleep down by the creek. Rather than enabling this dangerous behavior, we feel it is far more effective to provide warm and secure shelter for this population through existing programs like the Care Campus or the Cornerstone Rescue Mission. This is definitely a particular area of concern as South Dakota winter is right around the corner. We have noted 11 separate entities providing meals throughout the average week here in Rapid City. These are efforts outside of the normal efforts provided by the Care Campus or the Cornerstone Rescue Mission. And we've definitely had to acknowledge from the police department perspective that homelessness is bigger than us. We've partnered with many service providers in the community recently. Just to name a few, Journey On, a proactive street outreach nonprofit, Great Plains Tribal Chairman's Health Board, RV Ministries, the Cornerstone Rescue Mission, Mobile Medics from the Rapid City Fire Department, Woyatan Lutheran Church, Volunteers of America, the Care Campus, Pennington County Health and Human Services, just to name a few. And we're going to continue to collaborate with the community because we recognize that the homelessness issue is much bigger than the police department alone. So with that, I want to turn it over to Pennington County Sheriff Tome, as well as Barry Tice, Director of Pennington County Health and Human Services.
Thank you, Chief. We put together a lot of data for the media and others if you want. There's a PowerPoint with 8 or 9 slides that's available. We also can put it up on the screen, but it's available if you want some additional data after this. We can provide it to you. But to summarize a little bit of it, it's going to talk about what the Care Campus does, and then Barry's going to talk about what his office does as Director of Health and Human Services. But as you know, the Care Campus came online about 2 years ago, 2 years ago in September, and that's a partnership with multiple agencies. The City of Rapid City helped fund it. It was a $16.3 million investment originally. Behavior Management Services, or Systems, Behavior Management Systems, BMS, is a partner in the building with the Crisis Care. We have again, the Sheriff's Office, Health and Human Services, Lutheran Social Services participates in some of our addiction programs up on the second floor. And again, it's a combination of funding with city, county, and philanthropy support to make that happen. There's currently 174 beds in that facility. I can tell you we're not full in terms of the addiction side. With COVID, we made some adjustments to adapt to social distancing with COVID, but we still have some capacity. In terms of utilization of the space, it runs about 70% male, 30% female. It runs about 78% Native American utilization of the facility. And an interesting point is there's some rumors going around that we're dragging people down there and then throwing them in jail. Well, that's just absolutely false. That's not true. The 66 to 67% of the people that use the facility self-report to the facility. And then in addition, the police department, other law enforcement, we use it for system diversion. Some call it jail diversion. I call it system diversion because you're not burning public defender time, state attorney time, court time, or law enforcement time. But since we opened the doors, 2,395, so almost 2,400 diversions of people that were brought there as opposed to going to jail. So we're doing just the opposite of the rumors that are on the street that we're taking people there and then incarcerating them. It's just the opposite of that. And the savings to our community, and Barry put this number together, if you put somebody into the system, what's the cost to the system? Over the last 2 years, those almost 2,400 diversions have saved the community about $1.9 million. So significant savings to the system, as well as a better way to treat the people that are coming into the campus and being diverted from the system. So with that, of course, we'll be available for questions. And Barry's going to talk about some of their case management and what they do as part of the partnership with us. So thank you.
Good morning. I'm Barry Tice, the Director of Pennington County Health and Human Services, and I appreciate Chief Hedrick's comments on the number of agencies that really work in collaboration to address the needs we see in our community. And that is a big piece that we have done for years in our community. And so with the onset of COVID, we had to pivot how we provided case management services, and we've changed and really focused on street case management services with the Rapid City Police Department Quality of Life Unit. That's allowed us to increase our contacts along the creek and with our homeless population, and really work with a population that sometimes do not want to access the resources we have available. And I'm very proud of the employees at the CARE campus, our law enforcement officers, as well as our case managers from Health and Human Services that work tirelessly to address these needs in our community. And as Sheriff Tome mentioned, we see significant usage at the CARE campus, but the number of self-referrals was something we had never anticipated. So as we go into year 2, this is a huge piece and a demonstration to our community that there are many individuals who are starting to access a different choice in their lives and going to the CARE campus, which provides the staff at the CARE campus an opportunity to have these conversations. So, thank you. Sure. Good shoot. Over the past 2 years, there was 50,777 total admissions to the CARE campus. And as the sheriff mentioned, a majority of those are self-referrals versus law enforcement contacts. So that allows our law enforcement officers to address some of the other issues that are occurring in our community. And this is done through individuals coming to the backside of the building and pressing the button and entering. So it's a simple system. We've talked about this for years, utilizing the single point of entry system and allowing individuals to access behavioral health, substance abuse services, as well as case management services. And the last point I'll make with this is we're fortunate in a community of our size. We have a homeless mission that can address a large portion of our population, and we have the CARE campus, which allows for this additional assistance. And then as we move forward with the addition of One Heart, we have this transition of care and essentially a seamless transition of care that will greatly benefit our community. Thank you. And I'm sorry, this is Lisa Allison, the director of the Cornerstone Rescue Mission.
Thank you, and thank you for inviting me to be here today. Cornerstone Rescue Mission is a faith-based ministry, and we've been operating in Rapid City for 38 years. And our goal is to take homeless people who are sober and who want to make positive changes in their life and to walk with them step by step. We provide case management, shelter, food, clothing. We help them find jobs. We help them find a place to live. And we get the delight of seeing them move to self-sufficiency. But they do have to be sober, and that is something that the mission has had as a criteria for the 38 years of its existence. We do have 2 missions in town. One is the Women and Children's Mission, and they have 68 beds for women and children there, and we do have open beds available. The Men's Mission has 58 emergency shelter beds, and we do have plenty of beds available at the Men's Mission as I speak right now. But when both of those places are full, we go ahead and we put a waiting list into effect, which is common practice for missions across the country. And it's something that we don't really like doing. We'd love to be able to take care of everybody, but for safety issues, city ordinances, and things like that, we have to limit the people that can stay there. So now that I've said that, I'm going to go to the inclement weather, that when we have a blizzard here or a heat wave, or when we get the frigid South Dakota winter temperatures, we're going to take them and we're going to put them in the hallways, we'll put them in the lobbies, we'll put them anywhere that we can. And I know Care Campus does the same thing. There is nobody sitting up here or in the audience or any of the agencies that we work with that want people to freeze to death. So we're going to go, all of us, go out of our way to ensure that that does not happen. And we've got officers and deputy sheriffs that are out there patrolling, trying to find people and bring them in, either to the mission or to the Care Campus to ensure that that does not happen. And I cannot thank them enough for that partnership because it's wonderful. So when you come into the mission, you have 30 days to find a job, which is very doable in this economy. There's help wanted signs everywhere. And then after that, you can stay for an additional 60 days for a maximum 90-day stay. And most people and our guests have told us that they feel that that is sufficient amount of time to get their feet on the ground and to get the help that they need to move forward. Now, there are always exceptions to that, and we will work with them on a case-by-case basis, but 95% of the people that come through the mission are able to make it in the 90 days and sometimes even less. One of the biggest questions or areas of confusion that the mission gets is, do you charge people to stay at the mission? And the answer is yes and no. So I'll go to the yes part first. Yes, if you have income or you are working, you pay $7 a day to stay there. And all of that money goes into a communal pot that goes right back to the homeless people. So for example, if I have somebody who is getting a job and they need scrubs, we can take money out of that and help them buy the uniforms that they need, prescription medicines, glasses, things like that that I do not have a line item in my budget for. If you do not have an employment and you're not paying into that, then you do sweat equity for about $7, like an hour worth of extra work on the mission. So you either put in financially or sweat equity, and then when they do get a job, they will start contributing to the Fair Share Fund. It has worked for over 30 years. It's a great program, and we're going to continue because it has been so successful. But I hope that that clears up the $7 a day issue for some people, because I know that that is a concern for some. But of course, our priority is safety for our guests who live there, the people that come into our public soup kitchen, and for our staff. So that's why sobriety is mandatory for us. So I just wanted to cover a few statistics with you. Last year at our public soup kitchen, we provided 166,000 free meals to the community. The Men's Mission had 19,347 bed nights. The Veterans Wing had 3,486 bed nights, and the Women and Children's Home had 19,434 bed nights for the women and children. We're very busy. We love the homeless population. It's a privilege to serve God. It's a privilege to serve in this community in this way. And we're grateful for the people that want to walk alongside us to help us do that, because we don't do it alone. I can't do it without Barry, Sheriff Tome, Mayor Allender, Chief Hedrick, and all of the people that work for them, not to mention all of the other organizations that were mentioned earlier. So thank you very much. And I would like to turn it back over to Mayor Steve Allender.
Thank you, Lisa, and thank you, everyone up here for being here today. So, in the conclusion portion of this, there are services available for local homeless individuals. Local homeless individuals. There are not services available for the regional or statewide homeless individuals. Rapid City, Pennington County, cannot be a repository for every other community's homeless population. That's unfair to ask that, unfair to drive someone here and drop them off because they know we have services. These services are supported largely by taxpayer dollars. We have no plans to expand services to accommodate Western South Dakota. Communities must address these issues according to their own local needs. I will not use taxpayer funds to build or allow a building to be built that is going to encourage on-site consumption of alcohol by the homeless. That's a legitimate request, is that they need a building where they can drink safely. And if you want to talk about an oxymoron, that is the prime example of it. These individuals that you see, if you've seen them in their intoxicated state, their life expectancy is in their early 40s, and they will all not be with us very long at that rate. I will not use, or I will not accommodate public camping or a tent city. That's another request. I will not use taxpayer funds to build an additional treatment facility. First of all, because we have treatment beds available. And secondly, because it's a fallacy that the unwilling can be treated. Even though these folks are chronic homeless, they are seemingly hopelessly addicted, they still have the authority to refuse services. And that's what they do by and large. I believe it's time for the tribal government to weigh in to this discussion. We've had lots of conversations with tribal members, groups from the local reservations, but we have not had a meaningful dialogue with tribal government. And we would enjoy and look forward to working in partnership with the tribes on solutions that don't further enable the homeless. Some of the simple solutions right here in front of our nose. The homeless that are here from out of town should go home immediately. That might sound harsh, and it also might sound like it's far-fetched. They're homeless. Well, we can assist with transportation to those folks who are here and need to find their way back home. These folks left an existing support system to come here to Rapid City. And they don't have that support system here. So we want to help get as many of those folks back home as possible. The local homeless advocates should focus on mentorship, mentoring local homeless individuals to encourage them and help them access services, including addiction treatment. But the enabling must stop. The warm feeling one gets from feeding the homeless in a public space only puts them at additional risk. We have it right from their mouths that they are here in part because they are being fed in the parks. That full belly won't mean anything to them when the temperatures dip and the winds come up and they are out there alone. So that enabling behavior really must stop. We stand by, ready to help those in need, but this is not an exclusive government responsibility. We're divided politically just like everybody else. But I'm here to tell you that the government cannot be in a position to adopt everyone who has failed to make it on their own out there in society. There has to be a better way to do this. So the community must come together, including individuals and organizations, to solve this. Now, what I just said is really a mouthful, because here in the West, we don't work well together. We're statistically more likely to start up a brand new nonprofit to save the world than we are to volunteer for an existing nonprofit. It happens all the time, because I think the reward is internal for the people doing that. So obviously funding is needed for existing service providers. Everyone up here on this panel is funded, their operations are funded by taxpayers, with the exception of the Cornerstone Rescue Mission. Cornerstone Rescue Mission relies on contributions from the community. If everyone in this community would donate $1 a day, $5 a month, rather than complain about the homeless, or rather than complain that no one's doing anything about the homeless, we would have better capacity to do a better job with what we're trying to do. 38 years they have been up and running on a shoestring budget at many times throughout the year, wondering if they're going to be able to keep the doors open, but being driven to come back the next day to do the same thing over and over again. It's really sad, but you know, the primary complaint I get is, why isn't the city funding the mission more? Well, because government money brings about, is a disincentive to volunteer dollars. Where there's government money, there need not be any other source of funding, because the government can do everything in people's eyes. That's not the case. Making an organization dependent on government money can easily take away the will to survive from private funds. Obviously, volunteers are needed. My request to you is find an existing service provider and volunteer for it. Don't create your own group of friends to bake cookies or boil hot dogs and take them down to the homeless. That's not being helpful. Other support is needed, such as food, clothing, and supplies for local service providers. Homelessness is one of the most expensive things we do in government and as a community. The mission costs money to do what it does. Detox, the care campus, safe beds, costs money. When One Heart comes online, it'll continue to cost money. The city's already invested $5 million into that project, and will likely continue to invest more as time goes on. There are many nonprofits as well that are raising funds or applying for grants to try to do their own thing. And 50%, roughly, of the police and fire budget in Rapid City goes toward homeless services. That is $15 million annually going out of the police and fire budget to provide short-term, largely non-beneficial treatment to homelessness. Taking someone to detox, breaking up some fights, investigating frozen bodies out in a public space. Those and the medical calls. The ambulance is an enterprise fund. It pays for itself. There are no city tax dollars that go in to run the ambulance, but they're out there every day, and sometimes every hour of every day, providing service to the homeless, knowing they will never get paid. And as far as getting payments from IHS, don't get me started on that. That is a whole can of worms in itself. But between IHS funding, Medicaid funding, there's just, it's a losing financial proposition. There's no financial, no one in private business would ever do it because of the losses, but yet we in government do it. And all of that is to say nothing about the economic damage that is caused by homelessness. The homeless individuals lined up at your storefront, begging money from your customers, frightening people, making them feel scared as they're going to their cars. That's where the police get involved. That's where all these debates take place. As we've heard here today, there is rock-solid evidence that we have not and are not continuing to make illegal homelessness. We have not criminalized homelessness. That's one of the common homeless advocate mantras, is that we have used the criminal justice system. And I think that was true in the past, true out of necessity. So now here we are today. And I'm here to tell you, it's my commitment, and the commitment of everyone else up here, that we will continue to offer appropriate services to the homeless in Rapid City, but we need your help, and we need your understanding, and I would ask you not to complain, but to donate or to otherwise get involved. So I'll open it up now to the press for questions. If you have questions, I would ask you to go to the podium, as we are live streaming this press conference, and we'll take your questions here. If you have a question for one of these individuals, please let us know that too.
Hi, Shandara Bonnet, Rapid City Journal. Mayor Allender, you've mentioned a couple times that you or someone within the city has spoken with people who are homeless about what they're finding and what their needs are. Would you mind telling me who did that survey and how many people were surveyed?
I think I'll turn that question over to Chief Hedrick.
So our quality of life unit is the unit I had kind of talked about at the beginning, where we have officers proactively out working with our homeless folks and trying to connect them with service providers. Through interactions this summer, they've had the opportunity to interview individuals and trying to get a gauge on where they're from, how they got here. Some of the group was cooperative and explaining some of that information. Others didn't want to share. But we're talking about some of the new faces here in Rapid City. We're estimating probably about 75 new homeless people that we haven't encountered in years past. And does that kind of answer what you were asking?
Somewhat. I was also wondering, if I may, would you happen to have a breakdown of the numbers between local versus regional homeless population?
I don't have that available, but we could possibly give a ballpark on some of the services that we provide through the CARE campus. If Barry, you could get us close, possibly? Maybe?
Awesome. Thank you. Appreciate it.
The police department specifically has conducted an informal survey of all these individuals, one-on-one interviews. The typical homeless crowd that we deal with, we have existing relationships with. Either we know them by name or they identify themselves. What we've noticed with a lot of individuals here from out of town this summer is that they are less cooperative in terms of giving a name or providing information. But while Barry's looking for this, can we have another question from the media?
Yep, so my question was, besides the external individuals from out of town that are coming that are homeless, do we know if there has been a significant rise in the number of homeless individuals in the area compared to previous years?
Well, visually, we just talked about this, and visually we estimate there are between several dozen up to over 100 new faces in Rapid City just this summer. But since they live along the creek, and it is a time other than our standard homeless count, we don't have actual numbers from a day-to-day standpoint that I'm aware of. Any other questions? All right, well, thank you all for coming, and you can follow up with the mayor's office if you think of a question later and you want to have it answered through email. Thank you.